Hey guys, I'm super excited to talk to you today about preoperative nursing priorities of the surgical patient. So let's first take a look at our goals. The most obvious preoperative nursing priority is to prepare our patient for surgery by focusing on patient safety and patient-centered care. So why are nursing priorities in the preoperative setting important? Well, as you can see here, there are a number of risks associated with a surgical patient. These include the most obvious injury, infection, and complications, but risks can also lead to emotional issues in the surgical patient. By focusing on the preoperative nursing priorities, we are keeping our surgical patients safe and happy. And what is better than that? Okay, let's just take a closer look at the specific preoperative nursing priorities of the surgical patient. As a perioperative nurse, one of the most important things we focus on in the surgical patient is preventing wrong site surgery. So how do we do this? Well, of course, we're going to identify our patient by name and birth date. We're also going to verify with the patient that they know the procedure they're having as well as the site that will be operated on. The site will also be marked if there is laterality involved by the surgeon's initials. So obviously, if a patient is having their gallbladder removed, that obviously cannot be marked and there is only one of those after all. Another really important nursing priority preoperatively will be decreasing the knowledge deficit that can happen in our patients, which can cause them a lot of stress and anxiety. So how do we focus on this priority? We do this as perioperative nurses with the informed consent process. We verify that patients know all the reasons, risks, side effects, as well as benefits and alternatives of their surgery or procedure. Guys, please check out the specific lesson we have on informed consent to get more information on this topic. Another critical nursing priority of the preoperative patient is decreasing the risk of aspiration during the surgical procedure. So we do this by making sure the patient hasn't consumed anything by mouth after a specific time. Now keep in mind that sometimes patients will be asked to take a specific medication with a small drink of water. So we also want to decrease the risk of allergic reaction. So be sure to confirm any allergies that your patient may have. And be sure to ask about latex and even metal allergies for those patients undergoing an orthopedic procedure with an implant, because these things are super important for the surgery staff to know. We also want to confirm with our patients the medications that they have been instructed to continue and discontinue up until the day of surgery. For instance, typically for surgical patients, they are instructed to discontinue any anticoagulants or aspirin for risk of excessive bleeding during their surgical procedure. Guys, make sure you check out the lessons we have on the preoperative education of the surgical patient for some more details on this. So the results of lab work helps to increase our patient safety by ensuring they are physically prepared to go through surgery at all, or it can throw up a red flag if surgery may not be a good idea. So just the other day, I had a patient who was scheduled for a tubal ligation. So as a facility where I work, we have a protocol for pregnancy testing of all females of a certain age, as there are obvious risks to all in these instances. Well, in this particular case, my patient was pregnant, so unknowingly, obviously. So it goes to show the importance of lab work. Also, guys, of course, with surgery, we're always thinking about the possibility of infection. With this preoperative nursing priority, the focus would be on administering the appropriate antibiotic at the appropriate time and also preparing the surgical site. For example, clipping and prepping the area before surgery. So because the patient is under anesthesia and could be motionless for quite some time, we always want to consider the risk of blood clots. So to decrease the risk of this, we often use DVT prophylaxis, things like sequential compression devices or SCDs or TEDHOs, which are applied before surgery. Anesthesia is another big issue. So preoperatively, we want to confirm the patient is receiving the appropriate type of anesthesia for their procedure. And of course, this is going to be confirmed by the surgical provider and the anesthesiologist. Finally, guys, with consideration of preoperative nursing priorities, we want to make sure that we are supporting our patients emotionally. Surgery can be very, very scary to patients no matter how many times they've gone through it or how many people they know that have experienced it. We want to make sure we are meeting all of their needs. Okay, anything from, of course, their physical needs, but also religious and cultural needs too. So just doing these simple things can help patients to not feel so afraid. Preoperatively, it is so important that patients have the ability and are encouraged to ask questions. Make sure you let them know that any and all questions are encouraged, no matter how silly or unimportant they may think they are. And also, guys, it is critical that the patient follows given instructions, as they are all in place to keep the patient safe. In some instances, not following instructions will cause the patient's procedure to be canceled. And I see this a lot in surgery, working in surgery. So when we think of specific nursing concepts that we can apply to the preoperative nursing priorities, definitely clinical judgment, patient safety, and patient-centered care are going to come into mind. All of the preoperative nursing priorities that were previously discussed focus primarily on patient safety by reducing certain possible risks. And we get to this point by using our clinical judgment skills. Okay, guys, let's wrap it all up. The goals of preoperative nursing priorities will be to prepare the patient for a safe surgery through patient-centered care. We're going to decrease the risk of infection by the proper use of antibiotics as well as preparing the surgical site. We're going to decrease a knowledge deficit by increasing our patient's knowledge with informed consent. We are going to increase our patient safety by performing labs, DVD prevention with SCDs and TEDHOs. We will make sure the anesthesia type is appropriate for the patient. We're also going to confirm allergies, medications, the MPO status of the patient, and finally that the patient agrees with the scheduled procedure and surgical site. We're going to confirm that the surgical site is marked by the provider to prevent wrong site surgery. And finally, we can't forget about providing emotional support to our patients to decrease any fear that they may have going into their surgery. Okay, guys, I hope you enjoyed this lesson on the preoperative nursing priorities. Make sure you check out all the resources attached to this lesson, as well as the rest of the lessons in this course. Now, go out and be your best self today, and as always, happy nursing.